MPS webinar. And today's topic is telemedicine during COVID-19. It's a medical legal webinar. We are very happy to collaborate this webinar together with Gleneagles and also Mayor Brown. Could I invite Dr. Kenneth Tsang to give us an opening for this webinar? Dr. Tsang.
Thank you, Justin. You can hear me?
Yes, very well.
Okay, welcome you all to this webinar, and it is our pleasure in Gleneagles, Hong Kong, to be able to help facilitate and participate in this particular webinar, which I think is very important to Hong Kong right now. Not just because of the fact that there are patients out there who are requesting for this sort of services, but I guess Hong Kong is kind of like at a crossroad to either persuade or prevent our doctors in moving forward in telemedicine, because there are some sort of ordinance and guidelines around that may be based on some concerns and worries that our legislators or regulators are worried about. And we really want to start this discussion not to really kind of like turn over what has been decided or what has been presented, but rather we would hope to start a dialogue to make people understand more what telemedicine is and what it might be in terms of running in Hong Kong. To be honest, telemedicine has been around for so many years that it's really well developed, let's say in the United States or in Australia. In fact, in Australia, they went so far as to saying that they're going to develop a virtual hospital. And in UK, they have another model where they have been doing mental health services with telemedicine. And also there is this virtual ward concept. And in Hong Kong, to be honest, I think most doctors never really believe that telemedicine will take off, because doctors are really kind of like, there is always one nearby. You just need to go down from your home and there's one in the street next to you, maybe just 1 block away at the most. So why is there a need for telemedicine when it is already so convenient to find a doctor? But then lo and behold, here comes COVID. The pandemic actually caused havoc in many people's life, and including patients who need clinical care. So together with the IT development in Hong Kong, which has been very, very mature, we do believe that there is a reason that we should start thinking about telemedicine in Hong Kong right now. So the Gleneagles Hong Kong have been trying out doing some telemedicine. To be honest, doing it very, very easily with the easy way, just doing GP stuff. On the one hand, it is controversial whether we should be seeing GP or these episodic diseases through telemedicine. But on another hand, it is actually also one of the easiest to take on because of the fact that these patients are usually simpler to manage. So I put it to the panel, and then let's discuss and see how we would come to any sort of further discussion such that we could take this dialogue forward. May I pass it back to you, Justin?
Thank you very much, Dr. Tsang. It's certainly a very exciting time. Okay, may I pass to Mr. Kim Lee, our Business Development Director, to give us a quick MPS update.
Thank you, Justin, and thank you, Dr. Tsang. I've been asked this evening to say a few words officially before we commence the webinar. Doctors, healthcare professionals, lawyers, and esteemed colleagues, I am delighted to welcome you this evening. There has been an increased risk and prevalent litigation, particularly in Hong Kong. Your work is vital, so protecting your career and reputation with the world leading medical professional organization is to take advantage of the MPS intelligent risk management and the very best legal defense, an influential voice for your profession, combined with the approach towards providing freedom of practice with confidence. As a mutual organization, MPS's only purpose is to look after the professional interest of our members around the world. And during the current crisis, we had been doing so and working hard to support members wherever we can. We understand this ever-changing challenges faced by medical professionals, and we take our responsibility to members seriously by providing protection to every member, every step of your career. Last year, MPS arranged the largest global subscription relief that was introduced to support members who had experienced a drop in their private practice income by providing a payment equivalent of 2 months membership in 2020. In response to the work, we also had offered healthcare professionals who are undertaking further practice during the COVID crisis for those who had retired or had deferred membership so that they could come back to medical protection with their indemnity membership, so that automatically reinstating them completely free of charge. For those who were able to take it in 2021, MPS also introduced limited practice grades. Again, the aim of acknowledging the impact of private practice income. This continues to be successful in many markets around the world. In Hong Kong, MPS further supported members with the COVID-19 vaccinations that are currently being provided via the CBCs. So generally, we appreciate that doctors may have had some change in how they consult with their patients, particularly during the COVID crisis, which could mean holding remote consultations, which is why we're here today. So today, the panel of experts will explain in detail these matters that could arise during such consultations. So back to you, Justin.
Thank you very much, Kim. So this evening, the webinar will be highly interactive. We will have several cases to discuss, and we're privileged to have Dr. Kenneth Tsang, Dr. Rob Henry, Dr. Barbara Tam, and also Ms. Jamie Lam and William from Mayor Brown. And just before I forget, very fantastic support from the Gleneagles team and also the team here in Hong Kong. Now, let's have a quick opinion poll to understand how you would describe your current role. Okay, so there are 6 choices. Okay, maybe just a couple more seconds. Okay, please submit. Let's have a look at our mix this evening. Okay, it seems pretty similar. Half specialists, half GP, slightly more specialist. Okay. Now, may I pass the time to William, who will give us a regulatory update. Over to you.
Hi, everyone. Yes, hi, everyone. Thank you for taking time to attend today's webinar, using up your dinner time to listen to us speak about telemedicine. I'm William of the healthcare team of Mayor Brown, and I'll be giving an overview of the regulatory framework for telemedicine in Hong Kong. My part has been allotted 5 to 10 minutes, so I'll be giving a very high-level overview of the key points, but my presentation will be followed by some case panel discussions, which will be more interesting, more interactive, and will elicit the remaining important points. Next slide, please. So COVID-19 pandemic has definitely sped up the need for telemedicine services in Hong Kong, as many patients are reluctant to attend clinics or hospitals for follow-ups in fear of infection and quarantine. And indeed, our understanding is that there has been some telemedicine services in both the private and public sectors in the past year or so. The short story is that in Hong Kong, there's no specific legislation or statute governing the practice of telemedicine. But what we have is the ethical guidelines of telemedicine, which is issued by the Medical Council of Hong Kong, the disciplinary body for doctors, in December 2019. For most of you who may have already looked into telemedicine, you may have already read the guidelines before, but if you haven't, you can get a copy quite easily from the Medical Council's website. Next, please. The ethical guidelines start with a definition of telemedicine, which was actually borrowed from the World Medical Association's definition in October 2018. And it reads that telemedicine is the practice of medicine over a distance in which interventions, diagnoses, therapeutic decisions, and subsequent treatment recommendations are based on patient data, document, and other information transmitted through telecommunication systems. The ethical guidelines go on to explain that telemedicine embraces a wide spectrum of activities, obviously including teletreatment and teleconsultations with patients, but also collaboration between doctors using telecommunication systems and the monitoring of patients through telecommunication systems. Next, please. So the ethical guidelines are what its name suggests, just a set of guidelines. So they are meant to be broad and generic in nature, not meant to be exhaustive, expressly stated to be given fair interpretation. And this is partly because telemedicine is still a developing area. And the ethical guidelines also state that it is not a legal document. But the catch here is that the ethical guidelines also say that if you contravene the provisions in these guidelines, a doctor may be liable to disciplinary proceedings. So it is very important for doctors to study these guidelines carefully and to comply in order to avoid any disciplinary sanctions. Next, please. One back. I think we skipped a slide, yeah. So the ethical guidelines put a lot of emphasis on the issue of standard of care. In short, the doctor remains fully responsible for meeting all the legal and ethical requirements. And the most important point, I think, is that it states that the same standards of care that protect patients during face-to-face medical consultations apply equally to telemedicine. And it is therefore very important for doctors to be aware of the limitations and difficulties of telemedicine. The most obvious example being if a physical examination will provide important or critical information, then the teleconsultation should be aborted and an in-person consultation should be arranged in order to ensure that the patient is properly evaluated and treated. Next, please. The ethical guidelines then provide a set of guidance or set of rules telling doctors that you must be satisfied that the patient is suitable for telemedicine interaction. This obviously depends on the clinical context and the clinical goals of each scenario. Telemedicine must be provided as part of a structured and well-organized system, so the doctors involved must be trained and skilled in using the technology involved, and the technology must also have high stability. The guidelines state that teleconsultations must not be viewed as a cost-effective substitute for in-person consultation with patients. And more than once, it is emphasized in the guidelines that it is advisable or recommended for doctors to have a prior in-person consultation with patients before attempting medicine, and more importantly, before prescribing medicine for the first time. Next, please. The guidelines go on to say a lot of other important points. They are indeed, it is after all 6 pages long, but I have drawn up 4 key bullet points that I'd like to draw your attention to. The first is a jurisdictional issue, because the guidelines state that doctors who treat or prescribe must ensure that he or she has the appropriate license in all the jurisdictions where the patients receive the medical services, not where the doctor provides it. The guidelines also state the need for specific informed consent for telemedicine. So doctors are expected to specifically explain to patients how telemedicine or the teleconsultation would work, its limitations, whether there are suitable alternatives, privacy concerns, etc. In teleconsultations, record keeping is still essential. So doctors are expected to keep just as detailed, if not more detailed, notes of the teleconsultation. And lastly, the guidelines remind doctors that any data obtained through teleconsultations must be secured through encryption. Next, please. So to sum up, telemedicine is increasingly common worldwide and in Hong Kong. And it is important for doctors to study carefully and comply with the ethical guidelines, and also to look out for updates that may be published from time to time. I think the key issue is really whether doctors can achieve the same standard of care through telemedicine, given that there are some practical difficulties and limitations. And that brings me to my favorite bullet point of my presentation, and that is, if in doubt, doctors should consult professional indemnity provider and seek legal advice. And as you can see on the PowerPoint slides there's a QR code. So I would strongly recommend you to take your phone, scan the QR code, and it brings you to this beautiful page which has all the details and contact information of Mayor Brown's healthcare team, including Jamie and myself. Thank you.
Thank you very much. So please do not hesitate to contact Ms. Jamie Lam and William Chan. Thank you. Okay, so this brings us to our first case. It's 70-year-old female patient consulted the doctor via Zoom for the first time. The patient, during the video consultation, the patient is in wheelchair, accompanied by another person. And the patient complains generalized itchy rash for 10 days. Up on video examination of the rash, the doctor made a clinical diagnosis of urticaria. Now, doctor intends to prescribe some antihistamine and topical cream. The patient also mentioned there's also some cough and runny nose in the past 1 week. Okay, so a fairly straightforward clinical scenario. Now, just want to ask the audience opinion before our panelists comment about this case. So there are several questions. The first one, should the doctor prescribe to the patient after the teleconsultation? Okay. Should, okay, prescribe or not? Let's have a look. Oh, 77% no, 23% yes. Okay, second. Doctor should allow family members to pick up the medication on behalf of the patient. If the doctor decides to prescribe, the doctor should allow family member to pick up the meds. Okay, pick up. Okay, let's have a look. Okay, 62% yes and 38% no. Okay, first is prescribe, second is pick up. Finally, doctor is liable for the side effect of the medication suffered by the patient. Liable for side effects. Okay. Yep. Okay. 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 Yep. So we don't need to discuss about this. Okay. Now, could I invite Barbara to talk about, because 23% would prescribe and 77% would not prescribe. Do you have comment about this? Barbara, could you unmute, please? Thank you.
Right. Okay. Hi, everyone can hear me now? Good?
Yeah.
Yeah, okay.
Yeah.
Just now in one of the last slides of William's presentation, it specifically said that we should not be prescribing for the first time to patients we consult by telemedicine. So I think, you know, we have to be very, very careful when we do prescribe for the first time. And it would be preferable to at least see the patient before we actually prescribe the medicine. So I would be verging on the more prudent approach. I would probably insist on seeing the patient.
Okay. Okay. Rob, do you have any comment about in terms of our decision-making process in prescription?
Yes, I mean, I hear what Barbara says, and I was interested in the poll result there. And I think certainly to comply with the general guidance, if this is the first time this lady is consulting with you, clearly it is desirable to see her. That said, in the context of the pandemic and the fact that she may well have other health problems, I suppose there's a balance to be considered about whether the risks of attending a healthcare facility, would that put her more at risk? I mean, hopefully by now things will have moved on with vaccination and so forth. And again, I think when trying to, so that's the first thing I'd like to say. The second thing I would think about here is to pick up what Dr. Tsang was saying. You know, telemedicine isn't anything new. In the past, we have, you know, spoken to patients on the telephone and so forth, and sometimes considered it safe to prescribe. So then that's worth bearing in mind. And then thirdly, it's thinking about what is the nature of the condition the patient's consulting with, and secondly, the nature of the medication you're prescribing. So antihistamines might be at the milder end of concerns. Clearly, if somebody was looking for psychotropic medication or drugs of potential addiction, you'd be very much less comfortable prescribing remotely. So I suppose, you know, in this situation, it's what we're saying is, you know, be aware of the guidance and weigh up the pros and cons. I suppose ultimately acting in what you genuinely believe is the best interest of the patient.
Thank you, Rob. I want to follow up on the Dr. Tsang in terms of picking, if the doctor decide to prescribe 60% of the participant would allow the relative to pick up on behalf of the patient. Would that be a common process at Gleneagles?
Thank you, Justin. Prior to answering your question, I think there is an interesting thing that I noticed in the polls. First thing is that I do agree with Rob and Barbara that we really have to be very, very careful about accepting and seeing patients through telemedicine for the first time. So there is this risk that we must be very mindful of, and also the guideline from the Medical Council. So this is something that is very important. But then it's also interesting to note that up to 60% of our doctors do believe that it's okay for the patient's relative to pick up. So somehow they kind of, I mean, I'm trying to interpret that, they kind of like do believe that it is almost like okay to see if they maybe have seen the patients previously, that it's almost okay they can actually do telemedicine for this particular patient if, let's say, it's their old patient. So judging on that, then I would like to answer your question, is whether this particular patient has given the authority for the person to pick up. So from the ordinance point of view, and maybe William and Jamie can pitch in on that, it's whether there is due process that's been done to allow the family or whoever it might be to actually pick up the drugs for the patients. And at GHK, whether it's through telemedicine or not, there has to be some sort of authorization that identifies that the person authorizes a separate person to pick up medications for him or her. Otherwise, when this particular person who is carrying these drugs, when they're going home, that does not belong to him or her, he or she might get into trouble if they are stopped by police, and if the drugs prescribed actually, let's say, some of them are psychotropic drugs. So therefore, we have to be very mindful about the ordinances in Hong Kong that governs these stuff. So therefore, from our point of view and from what we're doing right now, even though we do delivery of drugs, there is very complex authorization process that we require right now. And therefore, it is actually not, to be very honest, this drug delivery part is actually the most complex part of the whole telemedicine process.
Jamie and William, any supplement regarding the pickup on behalf?
Yeah, I think I'll supplement on both questions 1 and 2. For question 1, I've seen the poll results. To clarify, the guidelines don't prohibit teleconsultations for the first time, but doctors are sort of strongly advised or recommended to have a prior in-person consultation before prescribing. So ultimately, I think it's a medical or clinical question whether the doctor can reach the same standards of care prescribing in those circumstances without the benefit of any physical examination or blood tests or other types of investigations. And the slides also say that it is the first time that the doctor sees this patient who is 70 years old. So we also have to think about whether there will be proper history taking, whether the doctor has access to the patient's full medical history, such as past known drug allergies and so on. I think for question 2, I fully agree with what Dr. Tsang has said about the picking up of medicine. And it is indeed very important for the patient to give authorization and for the authorization to be very clear about who will be picking up the medicine. And I think from a hospital's perspective, of course, there will be sort of procedures in place. But if we're talking about, let's say, a private clinic or a smaller scale clinic, then I think the doctor should also sort of maybe ask the person picking up the medicine to sign some sort of acknowledgement just to make sure that it's the correct person collecting the correct drugs for the correct patient.
And I perhaps I should also just add to that I think even after a decision has been made to prescribe and to allow a family member to pick up the medicine on behalf of the patient, that doesn't take away the responsibility of the doctor to properly explain, what sort of medications being prescribed to the patient, what other side effects, and have these properly documented. I think these are also very important.
Okay, thank you. Thank you very much. Our second case is 45 years old male patient received colonoscopy for change of bowel habit. The biopsy result came back to be adenocarcinoma of the colon. The patient was urgently contacted for early follow-up. However, the patient is not in Hong Kong, and a teleconsultation follow-up was conducted. After the teleconsultation, the patient requests the doctor to send the result to the patient's personal email address. Okay. Now, we have a few quick questions. Okay, should the doctor conduct the requested teleconsultation follow-up? Should the teleconsult happen, right? There's urgent pathology report and the patient is not in Hong Kong. Should it be conducted? Okay, and then 78% yes and 22% no. Okay, so we have second question. Doctor should send the colonoscopy and pathology report to patient via the patient's email as requested. Okay, should the doctor send the colonoscopy and pathology report to the patient's email as requested? Okay, 83% yes and 17% no. Okay. Now, finally, doctor should encrypt the report before sending it electronically. Encrypt. Okay. Should there be some sort of password protection to the report? Okay. Asking the wrong question. 100%. Okay. So this time, could I invite the lawyers to comment about 2/3 believes that the teleconsult should be conducted, and over 80% believes that the report should be emailed. Yeah.
Perhaps I will start. I think looking at this slide, I think the first key feature here is that the patient is not physically located in Hong Kong. So if you remember what William mentioned just now with reference to the ethical guidelines for medical cancer, it is expressly stated that doctors in Hong Kong who intend to practice telemedicine must make sure that he or she doesn't only just have the license to practice in Hong Kong, but must make sure that they have the license to practice, in the location where the patient, is. So in this particular scenario, I think before the doctor decides whether to do that, it's important to make sure that the doctor, knows for sure and, that he has the license to practice, where the patient is. I think that is the first key point, right, William?
Yes. Yeah. I would also refer to paragraph 22 of the ethical guidelines. And as I said, the area is still developing. The guidelines can be updated from time to time. So there may be some sort of ambiguous or gray areas. But it does say that it may be acceptable in certain circumstances when the patient is not in Hong Kong to provide them with general information on their medical conditions. And it is just that when specific medical advice or treatment is required, that the doctors should tell the patient to see a doctor in their vicinity. So this is something which would come into play in this case because there's urgency in the patient's condition.
Thank you very much. Barbara, on a practical level, because the patient is not in Hong Kong, the purpose of the consultation is to go through the reports. Yeah, do you have any comment about this?
Yes, I think it's actually no different when you call up a patient and say, oh, you must come in, and if you can't, then you need to tell the patient sometimes over the phone that there's something serious, yeah? So, and many of times we actually don't know where the patient physically is on the phone. However, in this scenario, I think it is, like William said, it's one of the scenarios or exceptions where because of the urgency of the condition, we should tell the patient what his results are and that he needs to seek an appropriate specialist in the country or region where he is. And I will actually provide him with a letter of referral to help him with his continuity of care of his urgent condition. As for the reports, depends on whether you have access to encrypted sort of email data sending. If you don't, the other way you can either get his relatives to pick up the physical report, you can deliver the reports to him by DHL, or like you said, if you are able, then you can encrypt it, send it by encryption. I think,
okay.
Yeah.
Yeah. Going back to the general and specific aspects of the advice to the patient, Rob or Dr. Tsang, let's say this is a general surgeon. He's very, very tempted to talk about the surgical options with the patient. Okay, should he still discuss, or would it be more appropriate if he or she make the referral to another surgeon where the patient is currently based?
Yeah, I mean, I think it clearly depends on what the plan is. Yeah, I mean, I can see it's a slightly artificial scenario for the sake of discussion, but you'd have probably, if you were investigating somebody for change of bowel habit, you would have thought that if part of that consultation might be what the follow-up arrangements were. So this does seem to be a range of options here, that this is one of your regular patients who's briefly outside Hong Kong, but will be returning for you to treat them, or is this someone you've investigated who has no intention of coming back to Hong Kong and plainly needs treated somewhere else? So I think the nature of the discussions would be predicated on that. I mean, clearly if it's somebody who's only out of the country for a short while, then I would have thought it would have made sense to give fairly minimal information, as William says, some general advice, like, there are some problems with your tests, but we need to get you back to have a proper in-depth discussion about the treatment plan at one end. At the other end, if this is somebody who's got no intention of coming back, then I think Barbara's suggestion of arranging a referral letter, rather than getting into a whole heap of detail about what you would do when, in fact, it's going to be somebody else who's going to be running the clinical treatment side of it, would be sensible.
Yep. And any general comment, Dr. Tsang?
Yeah, I guess this, as Rob has mentioned, this is a made-up case, so it does not seems to have such an urgency that it is kind of like implying. We do understand that adenocarcinoma is something that people would really want to immediately look for some sort of advice on what's the next step for treatment. But in terms of treatment timeline or the immediacy of the treatment, it's not as important in this case, I would say. But let's say it's a leukemia, which is of a very rapidly developing type, which requires immediate treatment, let's say within 1 or 2 days. So in those sorts of urgency, I think that the doctors really owe the patient a duty of care to actually immediately tell them about the situation. And therefore, I think that when that urgency is there, like what Barbara was mentioning, you really owe them a phone call, at least. I mean, not to say that it's a virtual consultation. You owe them a phone call to actually just call them up wherever they are in the world to ask them to see a doctor immediately. So I would think that the proposition about having a teleconsultation immediately is totally valid. But then obviously the next step, like what Rob was mentioning, if the patient is going to come back to Hong Kong immediately, then probably you can maybe say a few words telling them that I'll tell you more when you come back to Hong Kong in terms of how to decide on treatment plans. But if the patient is actually going to stay in where they are at that particular moment, then probably the next step would be maybe a teleconference together with a doctor at that particular location. And therefore then whatever the doctor will be, despite the fact that he or she is in Hong Kong, they can actually do a second opinion called a kind of service, which is, I think, perfectly legal at this moment. And therefore kind of like at the one time providing service and also good clinical care to the patients, and at the same time legally protecting the doctor such that he or she is not kind of like really providing the care to the patient directly, but actually through another practitioner in that particular location.
Thank you. Thank you very much, Dr. Tsang. Just to remind the participants that if you have any question, feel free to type in the chat box and we'll answer all the questions near the end of this webinar session. Now, in same country, different country, old patient, new patient, William, do you have some views on that?
We've talked about the ethical guidelines and discussed the case just now. I think there are 4 sort of scenarios that if we can just put up on the slide, or hold up now. These are the 4 different scenarios that we're talking about. For the first one, old patient, same country, I think the ethical guidelines don't prohibit this, of course. And so it will really depend on the clinical context and whether the same standard of care could be achieved. New patient, same country. So the ethical guidelines don't prohibit this either, but doctors are sort of advised or warned that for new patients, you'll have to be extra careful, especially if you need to prescribe. So I would put a star next to that. So it means to take extra care. Now, old patient, different country, new patient, different country. We've discussed that provides, in certain circumstances, providing general information might be okay. It will, of course, depend on the clinical context and, more importantly, whether the doctor has a license to practice medicine at where the patient is located. So if the doctor does not have the appropriate license, then he may only be able to give some general information, but of course, depending on the clinical context, as we have discussed just now.
Yeah, Yeah, and exactly our scenario just now is in this box here, the old patient, different country. Yeah. Okay, thank you very much. Now, so the next case is regarding lack of physical exam in a teleconsultation setting. 52 years old female patient, video consult for cough. The top differential is asthmatic cough, and explain to the patients about the limitation of the video consult. The patient requested some symptomatic relief. Therefore, the doctor prescribed bronchodilators and some cough syrup. Okay. And subsequently, the patient admitted for severe pneumonia, and the family sued the doctor. Okay, let's collect the opinion polls from the audience. Okay, so we have questions. Okay. So was it reasonable for the doctor to prescribe symptomatic treatment for this patient? Was it reasonable? Was it defensible? Oh, very good. We are asking the right question. 50-50. We are really asking the right question here. Okay. Okay. Okay, next. Okay. Was it reasonable? Okay. Yeah. Now, do you routinely ask for a teleconsultation follow-up? Okay, after this teleconsultation, do you routinely ask for a tele-follow-up? Like book a subsequent teleconsultation? Oh, 90%. Okay, routinely ask for a tele-follow-up. Okay, and finally, do you routinely remind patient to attend your hospital or clinic as soon as the condition change? Condition change, okay? Do you routinely? Okay. Okay, 102%, no, 100%. Okay. Now back to the scenario. Okay. So, Barbara, so it's 50-50, right? We have just under 100 participants. Half say they would give some symptomatic, it's reasonable to give symptomatic relief. Half say that it's not reasonable to give symptomatic relief. How should we weigh the balance here?
Well, I think first of all, let's say it's an old patient, so we know this patient already. However, if the patient was actually sat in front of you, what physical examination would you do? And without doing those, would you be able to be confidently making the diagnosis that you would have made? And if you feel that you are quite confident that it is what it is, then I think it is reasonable to prescribe the symptomatic relief medication. But if you are not, then you must stop the consultation there and insist that the patient must either come and see you or go to her nearest medical center or hospital. Okay, as we know that even if asthmatic, they can deteriorate quite quickly. Now, for those 50% who are giving symptomatic relief, please do have a follow-up, either a quick phone call in a few hours or something like that, rather than just give the medication and that's it. I think it's the most important thing is we are going to be judged by the same level of care as if the patient is face-to-face. So if you do not have enough confidence or information to arrive at our diagnosis, then we should refrain from continuing the telemedicine conference. And I think
Fantastic.
this is, yes, and this is something that the patient should be told right at the beginning of the informed consent part, that at any point, if the doctor feels that this is not an adequate consultation, then the doctor can choose to end the consultation. Is that correct,
Fantastic.
William?
I just want to invite Dr. Tsang here because Barbara has bring out a very important concept about termination of teleconsult. Yeah. In GHK, what kind of process even before the teleconsult starts in terms of
Yeah, thank you, Justin. Thank you, Barbara. You're very correct. In GHK, when we develop our teleconsultation system, we do actually have some sort of triage system, such that we do select our patient before we see them. So there are certain patients that we do believe that it's basically a no-go, even if they think that teleconsultation is something they want to try first. Take, for example, if he or she has a head injury, then probably it's no use at all to do a video consultation. They should just immediately go to their nearest doctor to be seen. So this is the first thing that we do. And then the second thing that we also do, which similarly to what Barbara has mentioned just now, we do have a policy to guide our doctors onto how to manage this sort of cases. In this situation, we will advise our doctor that they should immediately stop the consultation, because there is no way that a doctor, if they do believe that the patient may be unstable, to continue giving them good enough treatment just through the consultation. Take, for example, without a particular tool, the doctor wouldn't really know how severe the symptoms are. They would only be able to tell through the history taking how bad the patient might be feeling, but we won't be able to pick up a stethoscope and listen to it. We might not even have a peak flow meter to take it to make sure that to understand what the peak flow rate actually is. But of course, these days, there are other possibilities. For example, there are quite a few FDA-approved devices that we can allow these patients to use at home. So let's say if this is a regular patient that you have been seeing, and you are regularly monitoring their peak flow rate through these devices that they're using at home, and they have already a whole trend of peak flow rates that you are monitoring, then you will be very clear onto whether the situation is worsening a lot or not. So with that sort of information on hand, there is a possibility of seeing these patients. But of course, doctors would really have to be very, very careful because of the fact that there is a line to draw when you really need to stop and advise patients to come to the either hospital or to your clinic to be seen, such that you will really be providing the patient with the good care that you should be.
Excellent. Thank you. Thank you very much, Dr. Tsang.
Justin,
Jamie,
I'd just like to add from a patient relationship and risk management point of view, I think it's quite important to tell patients at the outset that the teleconsultation could be aborted anytime if the doctor thinks a physical examination or in-person consultation is preferred. Because if I were the patient and I took all the trouble to set up my phone, my webcam for a teleconsultation, I may be quite upset if the doctor tells me after asking me 3 questions that I need to attend the clinic after all. So I think it's very important to manage the patient's expectations in the beginning to avoid any sort of distaste or discontent with the patients.
Yeah. Just to add to that.
Let's say it. Yes, please.
Yeah, just to add to that, I do agree with William about this particular point. So from a business point of view, not exactly just from a doctor's point of view, what we do is that if a patient in the middle of the consultation has been found to require an immediate consultation at the doctor's clinic, we would actually do a refund. So therefore, if the patient do then immediately come to our clinic, we will actually waive the clinic fee. So this is kind of like the one way that you can actually manage the patient, such that they will understand that we are not trying to rip them off by taking maybe just a 3-minute consultation and then just leaving the meeting at home.
Thank you. Thank you. Okay, so we have a couple of bonus case. We have 10 minutes. Okay, so during a telemedicine session with your existing patient who has just discharged from the hospital authority from a stroke, from a cerebrovascular accident, the doctor gave instructions to the old patient on how to monitor the different sequelae or complications of the strokes. However, the patient suffered from an epileptic attack and was readmitted, and the family sued against the doctor. Okay. So we have a few questions for the audience. Do you routinely remind the patient to attend? Sorry. Okay. Should the doctor conduct the requested teleconsultation follow-up? So let's say you're the general practitioner or the family medicine doctor who manage the patient's overall medical issues, and the patient just discharged from hospital authority. Yes, should conduct the teleconsultation follow-up. The patient just discharged for stroke, 63% and 38%. Okay. Okay. And then doctor should closely follow up with this patient. Okay. Okay, we can see the result. Pretty okay, 76% versus 24% should closely follow up. Okay. And okay, conduct. Now, at that follow-up teleconsultation, the doctor should convert to a face-to-face consultation. Should the doctor convert to a face-to-face consultation? Okay, 70% and 30%. Okay. Okay. So in terms of, so maybe in the interest of time, well, we can jump directly to our lawyers in terms of what are the important considerations before whether we should conduct this teleconsult or not.
Perhaps I'll start first. I think in
Yes,
this
please.
scenario, the patient is an existing patient. So presumably the doctor would be relatively familiar with the patient's health condition. So that's a good thing. But assuming that the doctor here, of course, is in the private sector. So that doctor might not have sufficient information about the patient's recent stroke. So I think in this scenario, the doctors in the private practice could take advantage of, the e-health, the electronic healthcare record sharing system in Hong Kong, by getting the password from the patient and try to have access to the medical information within HA about the recent stroke before deciding whether to give further advice on, how to manage the sequelae of stroke. So I think that is, one of the first things I think that the doctor, should do in the circumstances. I think in this scenario, of course, it would be, I think, acceptable and sensible for the doctor to give some sort of general advice, on the situation. But again, I think it goes back to what we have discussed before, because the same standards of care apply to telemedicine as for a physical, in-person consultation. So if it comes to a point where the doctor feels uncomfortable or not confident enough to offer further advice or prescribe before seeing the patient in person, I think that, of course, would be a sensible thing to do, would be to ask the patient to return to the clinic for follow-up before taking it further.
Okay. Okay. And Rob, do you have anything to add in terms of follow-up?
I was feeling rather sorry for this doctor being sued by the patient, the circumstance, because I'm not a neurologist, but I'm not entirely certain what a physical face-to-face consultation would have allowed the doctor to see that would in some way have prevented the unfortunate patient having a fit. And simply, so I suppose it does come back to this question about if you are deciding how to see a patient, whether you do it remotely or face-to-face, the big issue is, would a physical examination make a difference? Is there something you would do differently? And if that was in the patient's best interest and in keeping with best practice, then it should be done. But in a situation like this, where I think it's perfectly reasonable to, in fact, maybe preferable for people who, have got problems to be followed up remotely, not dragged back to a clinic, just because you haven't seen them face to face and something happens. I think it wouldn't necessarily be negligent. So what I'd be interested to see the basis in which the family believed that a face-to-face would have done something differently. So, but maybe some of our neurologically qualified people would correct me if there was something that could have been done differently there.
Thank you very much. I'm aware that we have a few questions from the audience, and let me just read out the questions. Okay. Okay. So or Kim, could you read out the questions?
Delighted. So if I may, there's this one question that came in quite early, and it goes as this. If you insist on seeing the patient physically for the first time, what additional information would you get that could not be obtained from the telemedicine? So if you've seen the patient for the first time, what additional information can you get that could not be received from telemedicine?
I wonder if that was directed at that clinical scenario. I mean, I think this picks up the general point, doesn't it? That the doctor has to make a professional decision as to whether there is information that could be obtained and that was necessary to be obtained by carrying out a physical examination or seeing the patient face to face.
And if I may add to that, there's one thing that I always remind doctors about telemedicine is that telemedicine does not necessarily replace, or in fact, they should not just consider it as a replacement of a normal consultation, but rather telemedicine is something that is new, that would like the ultrasound in maybe several decades ago, or echocardiogram that is replacing a lot of the use of stethoscope. It's just a new tool to enhance your care for the patients. So you should really, all doctors should really look at how they could maybe increase the number of frequency that they attend to the patient through telemedicine, rather than just replacing their current consultation with them. So it will be a way to actually enhance our service to the patients and improve the care and outcome, but rather than just using it as an alternative to what we're doing right now.
Yeah, I think that's a really, really good point. And I think, we will learn, won't we? And it will, as physicians, we've always adopted new technologies and added it to our sort of range of options rather than, as you say, replacing it.
Yep.
Okay, if I could quote the next question. This question goes as, if you convert the telemedicine into a face-to-face consultant, would you prevent an epileptic attack?
I think that was my question to anyone with a neurological, better neurological understanding than I do. I'm not sure you would.
Great, okay. Okay. Another one is, what if the doctor in charge has no known contact with another expert in the UK whom he could trust or she could trust? How can one set up a teleconsultation with another medical colleague?
I presume that
in terms of the preparation, right? Yeah, Rob.
Yeah, I was going to say, I presume that was in relation to this idea of maybe somebody abroad who's going to stay abroad for their treatment. It would be worthwhile having, well, I suppose there's various networks, isn't there, for patients to find treatment or appropriate specialists wherever they are. I think it would depend on the situation, wouldn't it?
Okay, so we have answered all 3 questions. And over to you, Dr. Tsang, for the telemedicine in GHK.
Thank you, Justin. It's just a very quick run through of what we have right now at GHK. We are now offering virtual consultation, not just to general practitioner patients, so episodic diseases, but in fact, we're also offering to specialist patients. But obviously, this is really just for our current patients. We do not really see any new patients through virtual consultations. So we are kind of like still learning. Thank you. So this is the second slide. So as I mentioned, we do have a way to make sure that cases are being managed properly. There is a kind of like inquiry appointment making line that people can call. There will be actually a concierge service. There is a real person, not a machine answering, that they will be able to help make the appointment, help with the payment and everything. Once that appointment is made, the consultation request will actually be sent to our hospital, wherever the doctor might be. It will be either in our emergency department or in our family medicine clinic. And once that's done and the appointment's done, the patient can actually go anywhere they want, maybe still go back to work or maybe go back to sleep, waiting for the actual consultation. So when the time comes, they will just turn on their phone and then through the teleconsultation, be able to meet up with the doctors. So then after the consultation, and if the doctor was able to complete the consultation, then we will be able to then both send, if required, any sort of sick leave certificates or medications to the patient through a courier service. And this particular courier service, as we've mentioned just now, is very complicatedly organized such that there will be proper authorization from the patients to the one person who picked it up. And then there will also be a very technical use of QR codes and mobile apps to be able to check the patient's ID when they do arrive at the patient's home, so that when they do pick up the meds, we do know that there is the correct person is picking it up. Additionally, through this particular app, there is one thing that we do in addition, is that we also provide medication counseling through this app as well. So there is a pre-recorded video individually done for each patient. So it's not like a mass-produced one that is the same for everyone. So it's a pre-recorded one, but it is a pre-recorded one, but personalized for each patient. And there is also a hotline for them to call if they do have further questions. So this is the kind of workflow that we try to tell our patients that we have right now. It looks simple, but to be very frank, behind the scene is far more complex than you think. And honestly, we must admit that it's still a learning process for us. As I mentioned just now, this webinar and also the work that we're doing right now is really in the hope that it will increase the dialogue between doctors, patients, and regulators, such that there will be more clarity for doctors on how to start pursuing telemedicine. Because on our own, we cannot really do a lot, but we do believe that telemedicine is the future. We do not believe that the younger generation right now, when they become older, will still accept going to doctors even for simple symptoms. So I guess we are just trying to lay some groundwork on going forward on how telemedicine should go in Hong Kong.
Thank you very much. Certainly very great development. And if anyone would like to join the telemedicine initiative of GHK, should they contact the hospital directly?
They can contact us because honestly, to abide to the laws right now, we cannot provide any sort of service not at our locations. For example, I mean, doctors, if they are working at home, we cannot really be able to support this sort of work from home kind of like doctor services. Therefore, they will have to contact us so that we will be able to talk to them, explain to them how it works, and then therefore we will be able to, if they are really interested, have them on board to participate in the service.
Okay. Okay, finally, we value your feedback very much. So please scan the QR code and please give us comment about the organization of this webinar. Was it relevant to your practice? What was the overall rating? Was it easy to register in terms of the time and day of the week? And would you recommend to your colleagues? In particular, any suggestion for future improvement? And what kind of topics would you like in the future? So, Rob, do you have any closing remarks?
Really, just to thank everyone, particularly the audience for attending, but Dr. Tsang from Gleneagles and our legal friends, Jamie and William from Mayor Brown. I think this is a really exciting area of medicine, and I think we'll see this developing. And for that to be done effectively, I think it's really good that doctors work with organisations like GHK, which obviously provide a really high service of patient care. We're keen to get involved, and I know our lawyers are as well. So I'm looking forward to having future discussions like this. It'll be interesting to see what's changed over the coming months. So thanks to everyone for your input. I've really enjoyed it.
Thank you very much. Okay. So this marks the end of today's webinar. Thank you. Okay. Good evening. Have a good evening.